Welcome back to Unicate Talks, where we take serious science and show how it affects real people. This episode was created in collaboration with scientist and Master of Epidemiology and Public Health, Dr. Watkis. Today's episode looks at something many thought we had under control: measles. After years of steady progress, the world is now losing ground in the fight against this highly contagious disease. Let's explore what's happening, why it matters, and what we need to do next. There was a time when measles was on the verge of elimination in many countries. Vaccination campaigns had reduced cases dramatically. Childhood deaths from measles were dropping, and confidence in routine immunization was strong. But that's changed. Reported cases are rising again, and large outbreaks are reappearing in places that had made strong progress. It's a reversal few expected, and it signals a broader issue: gaps in routine healthcare, rising vaccine hesitancy, and systems strained by recent global events. The pandemic made this worse. COVID-19 disrupted vaccine services in every region of the world, delaying childhood doses and pushing routine immunization off the agenda. Millions of children missed their measles vaccines during this time. In some areas, parents delayed follow-up doses or weren't able to access clinics. That left more children vulnerable, and measles, being so contagious, spreads quickly through any population without full immunity. The World Health Organization warns that global coverage is now below the safe threshold. Measles isn't mild. It causes high fever, rash, pneumonia, and can lead to blindness or brain inflammation. It also suppresses the immune system for weeks, leaving children more vulnerable to other infections. And it only takes one case in an unvaccinated group for an outbreak to begin. Even countries with strong healthcare systems are affected. The United States, parts of Europe, and regions of Africa have all seen measles return. This is a disease we know how to prevent, yet it's resurfacing in schools, hospitals, and communities. That's where public health systems must respond, and quickly. Efforts to catch up on missed vaccines are underway in some places, but more is needed. We need mobile clinics, outreach to hard-to-reach families, and communication that builds trust. Misinformation about vaccines continues to spread online, and it's slowing recovery efforts. Education campaigns have to be accurate, accessible, and community-led. Surveillance is just as important. We must be able to detect outbreaks early and deploy resources fast. Countries need reliable reporting systems, contact tracing, and enough stock of vaccines to act when measles is detected. Prevention starts long before the first symptoms appear. Measles doesn't respect borders. International cooperation is key. Global partnerships, vaccine supply chains, and funding must be coordinated to stop outbreaks from spreading across regions. Health is global, and so are the solutions. It's worth repeating: the measles vaccine works. 2 doses are highly effective and have protected millions of children for decades. When vaccination coverage drops, outbreaks return. So the science is not in question. What's at stake is access, action, and public trust. If you're a parent, check your child's immunization records. If you work in healthcare or education, encourage families to keep vaccines up to date. And if you're involved in health policy, make sure systems are in place to catch up, communicate clearly, and protect the most vulnerable. This is the takeaway. Measles didn't disappear. It was pushed back by science, planning, and public health collaboration. Now that pressure must be renewed, it's not about blame. It's about recognizing risk and acting early. Every case prevented is a life protected. At Unicate College, we offer practical programs in public health, disease prevention, and healthcare systems. Whether you're a health professional or someone passionate about science and service, our flexible courses can help you shape tomorrow's responses to global threats. Knowledge, when applied, can save lives. Thank you for joining us on Unicate Talks, and a warm thank you to Dr. Watkis for his insight and expertise in guiding today's discussion. Until next time, stay informed, stay safe, and keep learning.